So I want you all to understand how this could actually happen. So cuticle instruments, they're used on the toes and the fingernails. And if you go into the wrong salon, you can actually draw blood. And then the technician takes it, instead of it getting maybe cleaned properly, maybe it's not sterilized enough, then it's brought to the next patient or the next person who's going to use this equipment. And whoever that person may end up being may be an unsuspecting victim. Here she is. Thank you. I think.
So which one's the clean?
Yeah.
So let's theoretically say the person before you had a cut. Blood got on the instrument. It's not sterilized properly. You have a cut on your finger. While they're using the tool, they break open the skin. Someone else's blood potentially gets into your bloodstream. Hepatitis is a bloodstream infection, and then you have contracted hepatitis B from a nail salon because they didn't clean the instrument properly.
And even if that blood dries out, you might think the virus dies. No, hepatitis B lives for a long time.
And we have a few tips coming up in just a minute, but for the time being, via Polycom, we have joining us to talk about contamination and transmission, Dr. Robert Gish, a hepatologist at the University of California, San Diego. He actually specializes in liver disease, and hepatitis B, of course, is one of those. And Dr. Gish, Nancy was actually and is still your patient, is that correct?
That's correct. She was actually at a wedding on the East Coast in Virginia when she presented with yellow skin, nausea, dark urine, really profound weakness. And she was hospitalized there for nearly a week with acute hepatitis, and that's where it was diagnosed. My role was to take care of her when she moved back to San Diego as that infection was lingering.
Of course, one way to protect yourself against hepatitis B is getting vaccinated for it. You mentioned her urine was very dark colored, one symptom of hepatitis. You mentioned jaundice, yellowing of her skin. A lot of times non-specific symptoms with hepatitis, fevers, just not feeling well. So once you came up with this diagnosis, the question, of course, how do you treat hepatitis B?
There is no cure for hepatitis B, but we can effect very powerful suppression of the virus and really get the blood clear of the virus in 95 out of 100 people choosing among one of the three medications we have. This is really good news.
But I think the take home, Dr. Gish, and you would hopefully agree with us, is some of the most unsuspecting places could potentially transmit this virus. So if you're going to go to a nail salon, make sure the equipment is sterilized.
Yeah.
You can even bring your own tools, your own polish. And if you have open cuts or wounds on your hand, that may be a day to skip the salon. Would you all agree with that?
Absolutely.
Yeah.
It's a great summary. I completely agree with all your points.
Well, Dr. Gish, thanks so much for joining us and the great work that you do. We appreciate it.
Thank you.
Thanks for having me. Appreciate it.